Like and subscribe for daily OT brain boosters. An OTR is observing a feeding session with a 3-year-old child. After forming and swallowing the bolus, the child moves it through the esophagus until it reaches the stomach. The therapist explains that this stage relies on coordinated muscle contractions that push the bolus downward. Which swallowing phase is described? D. Esophageal phase. An OTR observes an 8-month-old infant during a feeding session. Infant is able to move soft food around the mouth with the tongue, gather it into a small rounded bolus, and then push the bolus backward toward the throat, so it can leave the oral cavity and continue through the swallowing pathway. Which swallowing phase is described? B. Oral phase. During a feeding session, an OTR observes an infant who moves the food bolus toward the back of the mouth. When the bolus reaches the anterior facial arches, the infant begins the initiation of the swallow reflex. Which swallowing phase is described? C. Pharyngeal phase. An OTR observes a 6-month-old infant during a morning feeding session. The family reports that the infant follows a consistent feeding routine at 8 a.m. each day. As soon as food is presented at that usual time, the infant begins to salivate and shows excitement in anticipation of the meal. Which swallowing phase is described? D. Pre-oral anticipatory phase. Like, comment, and share your thoughts to help us grow and learn together. Learn something or nailed it? Follow us to stay OT sharp. You got this.